Okay.
Um, Welcome. This is Dr. Thomas Purtzer, and I'm talking in this segment about the most important thing about your chronic pain. I believe that the most important thing is that you have an accurate diagnosis. Oftentimes, patients, when they come to see me, have not had an accurate diagnosis as to what is causing their chronic pain. In order to arrive at an accurate diagnosis, I believe that you have to look at the entire person. You have to look at your not only your physical condition and your complaints, but we also have to look at the mental aspect of the chronic pain, the emotional aspect of the chronic pain, and the spiritual aspect of the chronic pain. I believe that it's very important to determine whether or not you have developed a chronic pain syndrome, and we'll be talking about that in a separate segment. I believe that next is very important to determine what is causing your chronic pain. I believe that by the time a patient comes to see me, if they have, say, chronic back pain, they need to have at least have had an X-ray and an MRI. If they haven't, we will arrange for that. If there's areas of your body that are hurting that have not been appropriately investigated, I believe that it's very important that a very thorough evaluation be done. Oftentimes, we have to order additional testing, such as additional X-rays or MRIs. Oftentimes, we need to order additional blood work. Very commonly, patients have, say, a vitamin D deficiency, or they'll have significant systemic inflammation in their body. They may have problems with their liver. They may have problems with anemia. They may have problems that require other specialists to see them, such as a gastroenterologist to evaluate for occult blood loss. We oftentimes have to make certain that you don't have some condition such as cancer that is causing your condition. It's very important that you know what is causing your chronic pain. In addition to knowing what is causing your chronic pain, it's also very important to know how this has impacted you. As I mentioned, many patients develop a chronic pain syndrome, and we'll be talking about that in a separate segment. But more commonly, patients oftentimes develop problems with depression, anxiety, lack of energy, poor sleep, lack of exercise, significant obesity, malnutrition, very poor eating habits, and all of these need to be diagnosed. I believe that we also need to make certain that we do not miss any medical conditions. It's very common for me to diagnose a low testosterone state in men that have taken opiates for any period of time. And so on your initial evaluation, if you've taken opiates for a period of time, we'll administer a questionnaire and see if you possibly do have a low testosterone state. Women, it's also very important to understand the hormonal state. Lastly, I believe that it's very important that we look at your overall function, and we'll ask a lot of questions about your overall body health, how strong you are, how capable you are of doing certain tasks, how much you exercise, and how well you sleep. So I believe that it's very important that you have a very detailed and thorough evaluation that looks at all aspects of your health. We need to look at not only your chronic pain causation, but we also need to look at what are called neuropsychological diagnosis, medical diagnosis, and then assess your physical and functional capacity. So I believe that we need to make certain that that's done, and we need to look for something that we can cure so that we can get your chronic pain taken care of and get you off of medications if that's appropriate. So that's what I believe is one of the most important things in chronic pain management, is to know the exact diagnosis. I want to thank you for listening to this segment.